Good afternoon. We are back again for another episode of our Friday noon webinar series. My name is Camara Seals. I am the policy director here at the Arkansas Public Policy Panel. We have my co-worker and colleague Osiris Bali, who's the racial equity coordinator. And our guest today is Senate Minority Whip, Senator Fred Love. Good afternoon.
Good afternoon, and thank you all for having me.
Well, thank you for taking time out of your busy schedule to be here with us on today. We are delighted to have you and looking forward to a good conversation today. So let me jump in first by asking you. So you're in leadership. Tell us, what does a minority whip do? What is your role as minority whip?
Well, as minority whip, I'm there to support the minority leader. And actually, it's kind of an old term in which we're supposed to be whipping the caucus into
Right,
line. And so
right.
I'm there really to support the minority leader, to make sure that the message is pretty consistent, to help the other members as well. And so it's pretty much just making sure that everything goes as planned, and really supporting the minority leader.
Okay. Well, that's great.
Both.
Right. So I want to ask, and then I'm gonna turn it over to Osiris, but I want to make sure that our viewers understand, because they always hear us say the Republicans have a super majority. And so for those who don't know, Senator Love is a Democrat, and he is in the minority, that hence the minority leadership role. Okay. Um, but I do want you to share with our viewers the numbers, because I think, I know everybody don't know the numbers. Many of us know what it looks like, but there are 100 members of the House of Representatives
That
and
is correct.
35 members of the Senate. So
Correct.
what are the numbers, Democrat to Republican? What are those numbers?
I'm not too sure in the House. I think they have 19 because I think they did pick up a seat. So I think they have
Right.
19 in the House. In the Senate, we only have 6. And so when you begin to talk about the super majority, I mean, really you're talking about what it really takes to pass legislation. And
Mm.
once you hit a threshold where you have 3/4 of the membership, you can pass any type of appropriation, any type of bill without the assistance of any other of the other party. So, that's why, having a super majority is that impactful, is because you can pass legislation, you can move legislation without the assistance of the other party.
So having a super majority is not good for either side.
Well,
Well, let's put it this way. Let's
I
put it
would.
this way. I didn't word that right. I didn't word that right. What I'm trying to say is having a super majority on either side of the political coin is probably what's not best for democracy.
And that's what I was gonna say. I
Yeah.
mean, in if while I would surely love a Democratic supermajority, it can also pose its own problems.
Yeah,
So,
exactly.
but for the sake of democracy, when you have a supermajority, it tends to seem one-sided, and so we're experiencing that right now.
Right. So what does it take? Because I know there's bills, legislation, then there's appropriation bills. So
Correct.
what are the thresholds for
So the
pass?
So the thresholds for appropriations are always 3/4. Some of the bills have just we have threshold on constitutional amendments where sometimes you have to have a 2/3 vote. And then regular bills are just a simple majority, 50+1,
Okay,
or 50% plus one.
right.
And so that's what you have generally when you begin to talk about regular everyday bills that people see on the
Mm,
calendar. But when you get to the appropriations, it is 3/4 of the majority of either
okay,
house.
right. So with this imbalance or supermajority, it makes it also difficult in committee for committee work too, right?
Well, here's the thing is in I'm not sure because I can't speak on the House anymore because I don't know what rules they have adopted. But
Right.
in the Senate, they made it a little more difficult with the rules. It's all about the rules that they put in place. And so they made it to where no Democrat it can't be more than two Democrats on the committee. It can't be Democrats can't be on leadership on major committees. So the primary committees like education, transportation, revenue and tax, Democrats cannot hold any type of chair position. So chairmanship, vice chairmanship, that's out. On the specialty committees, we can. And not to say that those are insignificant committees, but the major committees
Mhm.
versus the ones that are not major committees. And
Right.
so it's the rules that people put in place to ensure that you try to silence the voices, the voices that could be opposing um, your legislation.
Right, right. Yeah, we remember when that happened and we weren't happy, but there was nothing we could really do.
Yeah, I mean,
And we sat helplessly like, oh, okay.
yeah,
Mean
and
spirited. That's what we called
we
it. Mean
and,
spirited.
and that's what we said. I mean, even now, I mean, with 6 Democrats, you can only be on so many committees. And
Right.
so to kind of have those rules, I mean, are not, it's just a mean spirited move.
Mm-hmm. 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 Yeah, I know Osiris got some questions on policy and bills. So Osiris, I'm gonna turn the mic over to you.
Yeah, so thank you again for being here with us, Senator Love. Uh, I'll just kind of jump into the general legislative process with you.
Okay.
Uh, Personally, or just speaking as I guess, a constituent to you, what are your top priorities for this legislative session, and how do you plan to address them?
Well, I mean, I am a public health person, so I'm going to deal primarily with some things that are regarding public health. One of my major bills, and I've been working on it, was one where, and it was a constituent bill, as a matter of fact. Um, a lady came to me and she had, and it's been in the news, but she had a grandchild who was stillborn, and the crematory sold the body of the grandchild. They said that they cremated him. However, they did not. They sold him to somebody in Pennsylvania, and then somebody in Pennsylvania sold the body to somebody in Minnesota. And so I was like, at first, when the lady approached me, I was like, ma'am, I was like, this kind of sounds too far out there. But I did go back and research it, and I had the Bureau research all the legislation behind this, and there was no legislation protecting. And so having, my mom was cremated, well, hopefully so, but
Right.
um, having someone that a loved one that has been cremated, I mean, you're respecting someone's last wishes, their final wishes, and to think that they don't make it through the process, that's just terrible. And so that's going to be one. The second one is one that I'm working with in the FDA, and something that I feel is majorly important because I have a wife and a daughter, is dealing with the hair products that African American women use. and the ones that have the formaldehyde and the endocrine disruption chemicals in them. And so I'm going to be working on legislation around that. So anything that's kind of around public health is one that this is legislation I've been working on. Maternal health has always been on my list of as far as is making sure that we're getting the care to our community, because maternal health usually it impacts African Americans far worse than any other community. And so I'm working on maternal health piece as well. And really I want to push the 12-month postpartum. I mean, a lot of people have kind of used that, and but really that is probably the most critical piece of legislation. And I know the governor's fighting it, and I know that we have to, but that's probably the most critical piece of legislation that we might be able to pass this session is if we can get that covered through Medicaid. That will impact so many persons outside. Little Rock is my primary area, Placer County is my primary area. And so we pretty much have the resources here. But once you get outside of Northwest Arkansas, the resources begin to get a little more scarce. And so those are kind of some of the points that I would say that I'm going to be working on and pushing this session.
Yeah, thank you. Healthcare is major issue for all people here in Arkansas, and just the ways that we can do a better job of protecting public health and promoting health equity, and making sure that we're establishing standards. Because, like you mentioned, I didn't know anything about that bill as well. I mean, I didn't know anything that there was no law in place about cremation and people selling bodies and things of that nature. So I think it's something that we definitely need to educate ourselves on, and I think this legislation that you're filing will definitely do that.
Well, I will tell you,
ahead.
I've been in the public health space for quite some time. I remember when I first came to the legislature, one of my campaign promises was building a health clinic in my area, because in Southwest Little Rock we had a lot of people. We had an old county health unit that was just dilapidated. They couldn't provide the services that they needed, and so that was one of my first campaign promises, is getting the money to build that clinic. And then I ended up partnering with Children's Hospital, and Children's Hospital ended up building another clinic. So, I mean, when you can take care of your young people, and I'm not, no, don't get me wrong, I think everybody should be taken care of. But when you can make sure that your young people are healthy, they can grow up and have healthy lives. And that's kind of one thing that once I started out the gate in the legislature, that's one thing that I did. And so a lot of people, I'm not going to say a lot of people, but some people in Southwest still don't know that those clinics are built, and we built them like that because of the fact that we wanted a one-stop shop so that people can get their health care. And so if you come out to Southwest, you'll see the health unit there where you can get your WIC and you can get your family planning, different things like that. Children's Hospital Health Clinic is right next door. And then we have trails. I had them link trails to DHS so that you can get your, SNAP benefits and different things like that. So, making sure that you can have a one-stop shop so kids can be healthy. I mean, that takes a load off parents, but also it's kind of like a woodshed effect. So,
Right.
Right,
Can I
right.
do a follow-up question? I heard you mention going back to the postpartum care.
yes, ma'am.
And I know there has been some talk of some bipartisan collaboration on this issue. Now I know also heard the governor make some comments about this. Do you know if she is supporting? Because I heard you say fighting, so I just want some clarity as far as Medicaid expansion for postpartum, the
So
12
here,
postpartum.
here's the thing: the governor's we have certain services that would be covered in that postpartum, that 12-month period. However, you want to make sure that it's a continuity of care. And
Okay.
that's what the 12-month postpartum bill really does. It's ensuring that you have continuity of care. You're ensuring that, hey, that mother is getting followed up at 60 days, at 90 days, 120 days to ensure there's no complications. Most of the time, and for persons that have health insurance, sometimes you do go home and you don't, you get checked back in, but there are some people that don't have that insurance. And so after that 60-day period, and that's when that Medicaid switches off. After that 60-day period, if you're trying to piecemeal something, that's not going to work. It needs to be hey, we're going to ensure that this mom has care for that 12 months. And so whatever she needs, whether there's the mental health, a piece of mental health, or she needs to come back in because she's having some complications or she's feeling something. I mean, she's free to come back in, and we're taking care of that. We do not want mothers worrying about any kind of bills that they may have, and so they neglect their care. We want them to be followed up and ensuring that they are healthy as they can be.
Great. Okay.
And so that's the difference. I mean, the governor, while we do have some things in place, and I'm not saying that we don't, the thing about it is the continuity of care. So we need to ensure that whole 12-month period is covered.
Right.
And while we're on the topic of health, I know that you're a sponsor of another bill that addresses better public health and encouraging more healthy behaviors. You got a bill, House Bill 1079, which is was seeking to mandate health benefit plans to cover specific genetic testing and evidence-based cancer imaging for certain individuals.
And I think that the major sponsor of that bill, I think, might be Fred Allen, who the House sponsor for that bill. And yes, I'm for any bill that will improve the public health of the citizens of Arkansas. So, but go ahead. I'm sorry I cut you off, but
yeah, and now that you mentioned that, yeah, you probably right. It's House Bill 1079, and it is Fred Allen, but it's also another bill that addresses just better health care coverage. A bill that's helping detect gene mutations and that's associated with increased cancer risk. And in particular, speaking about women, mutations such as BRCA1 and BRCA2 that have links to breast and ovarian cancer, and making sure that patients have this access to this imaging screening without facing those financial barriers. So that was just another bill that I was thinking about because, we want people to not fear the financial end of it and not go get the testing that they need because they just might be in a situation where they feel like they may not be able to afford the health care that they need. So.
And then the one other thing, the one other piece is that sometimes you run into these where health coverage plans will kind of deny the first round, deny the second round. They will, and then if you don't have pre-authorization, they send you through another loop. And so we're trying to take down all barriers that could pose an issue so that people can get the care that they need. And that's the simple fact. I mean, you don't want your health coverage plans putting people through the hurdles and making them jump, because the more hurdles you have, and it's seen in any research, the more hurdles you have, the less likely you are to receive that care that you need. And once you go down that road, people then tend to have increased cancer risk, increased and poor outcomes. So yes, so we need that bill to be passed. So and I think that you may have some insurance companies push back on that, but hey, we'll still be fighting.
Got to fight. let me pause right here for people who are watching. Feel free to put your comments or questions for the senator. Put your questions in the chat or in the Facebook so that we can ask, so that you can get your questions asked. So this is a very valuable time we have with one of our legislative leaders. So we definitely want to take advantage of the time and the senator's expertise. One thing I wanted to bring up, Senator, the bill, and I don't know, I think you said it was SB 58.
Okay, yes,
Yeah,
Senate,
that
Senate
bill.
Bill, Senate,
So
Senate Bill
tell us,
58.
right, so tell us what that bill is, the name of that bill or whatever, and what it does, because I think it's very important for us to be educated on these issues, and that's what we're trying to do. And sounds like this would have a far-reaching impact.
It,
if
and it
passed.
does. And I don't know how I became kind of like the spokesman for this bill, but I did an interview on it, and then they're like, "Oh yeah, you did a good interview." And
Okay,
really, I mean, really, there are pros and cons to this bill, but I think there's more pros than there are cons.
right.
Senate Bill 58. I don't know it's the specific caption of the bill, but what it does is it allows for non-governmental hospitals or not-for-profit hospitals to actually own and run retail pharmacies. And so 50 or so years ago, they had they placed kind of a moratorium on hospitals being able to, non-governmental hospitals. Now, for-profit hospitals can own pharmacies right now, but non-profit hospitals can't. And so you have 3 or 4 nonprofit hospitals that have. Children's Hospital has a pharmacy. UMS has a pharmacy. I think Baptist has a pharmacy. But within the legislation, what they did specifically was they said that pharmacy cannot be located except that specific area, that specific place. And so so say for instance, if Children's Hospital had it located in the center of their hospital, well, then they can't move it. So you can't provide drive-through services. You can't provide, and so that's what's happening at Baptist, is that they want to provide drive-through services for their patients, but they can't because they can't move the pharmacy because in the legislation it prevents it. It's an odd piece of
Yeah,
legislation.
is that what this piece of legislation does?
Yes.
Prevents them from relocating the pharmacy?
Well, no. This legislation would allow them to
Allow them to, right.
will locate the pharmacy, but not only will this legislation allow them to move their current pharmacies, but it will also allow them to own other pharmacies. So the major crux of this bill also is access. And it's because so many times you have people that come into ERs and you leave with a care plan. Miss Seals, this is what you had. You came in with an emergency and we're writing your prescription for this and this. Well, if nonprofit hospitals can fill it, guess what? I can go get you your medication right now. So I'm sending you home with your medication. Well, there's an argument that, well, we already allow hospitals to do that. Well, it's only some hospitals that can. All hospitals can't. And most of your hospitals now are nonprofit hospitals. And so that's why kind of you're hearing this uproar with pharmacists. Now, we are the only state to have this moratorium. We are the only state. The other states around us, they don't have it. And so, you're dealing with 340B plans, which allow the purchase of cheaper medicine to sell to your patients, and then the share that it makes up. So say for instance, I bought a medication, I'm Children's Hospital. I bought a medication for $10, but it retail sales for $75. I could sell it to you for $75. The difference that I make on that medication, which is $65, I have to put that money back into my mission. So really it's there for charity care, because that's
Right,
what
right,
nonprofit hospitals are set up
right.
for. And so you hear on the pharmacy side saying, hey, what if we have a proliferation of just say, for instance, UMS wants to set up 20 other pharmacies. Well, that gives direct competition
Right.
to other pharmacies like Walgreens or whoever. So really, I mean, and I had concerns about hey, what if a hospital does want to have a proliferation of of uh, of pharmacies? But here's the thing: is that there were people that came to testify, pharmacists that came to testify against the bill, and when they said, hey, one guy said, I had 26 pharmacies throughout different states, throughout Missouri, throughout Oklahoma. Wait a minute, they don't have this moratorium and you're doing just fine. So then why can't Arkansas? And
Mm,
so and so this is just a special piece of legislation that is only in Arkansas. And I think, for the betterment of our outcomes, the betterment of access, because that's what you really want. You really want to stop people coming back into your emergency room if you can.
yeah,
And so
right,
access to medication is one of those things, because I
right.
mean, people have issues with transportation, people have
Mhm,
multiple
absolutely.
issues, but this would help provide the access to medication. This will help provide better outcomes.
Yeah. That sounds great. As you were talking there and you were saying Arkansas is the only state that has this kind of moratorium. Sadly, Arkansas is the only state that's at the bottom on a lot of things,
Yes, and
Uh,
maternal health and
maternal health, exactly. That's why we've got to do something. And I'm glad you all are working on it. But we have got to do something in Arkansas around maternal health. We just cannot. And I think everybody recognizes that, but it's like, what is it? And of course, the Medicaid expansion is a great solution to that. But it does get, I tell you, doing this work, it does get challenging because there's so many good fights we need to be in.
mhm.
Like I said, being at the bottom on this issue, with CFC, we have a landlord tenant priority, that we're going to be trying, but we've had this before,
I,
session after session after session. And, at one point we're still the only state, I believe, without an implied warranty of habitability, something where we are more friendly to our tenants that rent. So we've got a lot of work to do in Arkansas. So
we do. I remember running the landlord tenant legislation.
mhm.
Probably, that had to be about 3 or 4 sessions ago.
Yeah, yeah,
Because I mean, it's so sad that when you look at that, just the habitability standards, we
right.
don't have that. And then because I used to run a housing agency, and so you look for HUD, you look to HUD to say, hey, do you have a standard? You have a standard here,
Mhm.
and it's such a low bar.
Yeah,
It is such a low bar. For instance, if you say, hey, the house has to be wired correctly. I mean, like, come on, I like
who should say that?
really, like, does that have to be said? And
Right.
it's so sad. And then you have landlords on these insurance and commerce committees.
Yeah,
And
yeah,
and I think this is a direct conflict, because now you're
it is.
voting on legislation that it really impacts you.
Yeah,
Uh,
financially, right.
Financially. And so,
Mhm.
and I think that's really a sad part when you look at, you pull back the curtain on politics. I think
Mhm.
that's the sad piece of it, is like you have legislators that will really be directly impacted by the laws that you put in place, so they vote against them. And
Mhm.
so that's a disheartening part of
It
politics,
is.
because these are landlords, or they're I
Yeah.
could go on and on about it, but
Yeah.
I can, but I will say this though, and this is one thing, and I'm going to mention this SB3 that Dan Sullivan has, and I haven't read it. I haven't read it just really studied it, but rolling back the civil rights, rolling back, you know, they want to say it's just affirmative action, but it's much more than affirmative action. It's basic civil rights, how you should civilly treat somebody. To roll back all those rights, that's going to impact the work that we can do around maternal health, because we know for a fact, without a doubt, that the disparities in healthcare, the disparities in maternal health, we're going to have certain programs for certain demographics. And so these are the things that you put in place that will impact maternal health. And people don't see that. And so we really have to ensure that we're making the argument that, okay, how are we going to reach these mothers? How are we going to reach these mothers that are African American or Marshallese that really need a special type of program because you're trying to get to that demographic, but yet you want to support a SB3. Those are things that people don't think about, or I'm not going to say, I'm going to give them the benefit of the doubt when I say they don't think about, they just don't care.
Don't care, yeah. That's more like it, they don't care. And I know Osiris has read that bill and probably can chime in on it, but sadly, when it comes to those issues, we're seeing that around the nation, and it's spreading like wildfire in legislatures, in state legislatures all across the country. Sadly, because of who we have at the helm right now.
Yeah,
So,
people feel like it's a mandate
bad.
that there's a
Yeah.
mandate that they pass these laws. I mean, when you have someone trying to destroy the EEOC, so now it's not enough to actually to try to destroy the civil rights at the state level, but then you have no place to appeal. So if you're getting discriminated at the state level, we used to be able to say, well, hey, guess what? I can file it in federal court. Well, now you can't even file it in federal court because the EEOC, if they don't give you a right to sue, if you've been discriminated against, they don't give you a letter of right to sue. Guess what? You can't sue.
Can't sue.
And so people need to really understand the dismantling of the different institutions that Donald Trump is doing to really put us back, to roll back civil rights to where, even, I'm not going to even say to where our parents were, or where our grandparents were. So I think that people really need to, it kind of upsets me when people say, well, I can't believe that. No, Donald Trump told you exactly what he wants.
He told you.
And so then now people at the state level feel like it's a mandate, and it's not. And okay. All right, I'll turn it over to Osiris.
No, I would see you shouldn't do things like that, because I'll continue the conversation. So I'll stay in this lane a little bit and kind of, I guess, segue to something else, just on a personal note, because SB3, well, we know exactly what it is. It's more than affirmative action. It's going to affect higher learning institutions. It's going to affect public improvements. It's going to have a big impact on women entrepreneurs as well too, because a lot of the diversity and minority initiatives address things that women need too as well.
That's correct.
But and we're going to be talking about SB3 throughout, the session until it's heard in state agencies and wherever it goes from there. But also, I guess, to kind of, like I say, segue away from that, what tips or advice do you give people who want to keep up with the legislation and want to know what's just the everyday person that's working and just trying to stay engaged, but they may not be able to go to the committee meetings during the daytime at the Capitol, but they want to do things like chime in, possibly through email or letter writing? What ways can they stay informed, or what ways do you suggest staying informed and knowing what's going on in the midst of the workday.
Okay, and that's a good
Or,
question because
or outside of the workday when you have to work, but you want to come back after work and stay informed about what's going on during the legislative session.
well, thank you for that because I talk on this all the time, and really there's a couple of things. Number one is this, is that we are a citizens legislature, meaning that you put us here, so you cannot be you cannot be afraid to call us and talk to us. That's number one. You don't know how many people they like. Well, we can come to the Capitol. Like, yeah, it's your house.
Mhm.
So number one is knowing that they have access and they can come to any meeting that they want. And I know I'm getting to where you are, but I want to first of all inform people that you can come to the Capitol anytime you want. You can sit in any meeting anytime you want, and you can speak anytime you want. If there is an issue on an agenda that you want to speak on, you just really need to know. And the process is just putting your name on a piece of paper and signing up to speak. And don't worry about having the perfect words. Don't worry about come. You can sit in the room or you can speak. So that's number one. I just want everybody to really be aware that the Capitol is not some magical place and the doors are no. It is the people's house, and people need to begin to think about it like that. Because far too many times, the other side is thinking about it like that, and they come to the Capitol in droves, and they come and speak, on their experiences. They come and speak on their life experiences. So that's what we need for people to do. But number two is, I think when you begin to break this down, Osiris, people need to pick up the phone and call. I mean, a quick conversation does not, hey, tell somebody, hey, you know what? This is what I feel about this bill, Senator Love, and this, that, and other. I mean, there are people that call me from Northwest Arkansas. I'm not their legislator, but they want to let me know, hey, I am your constituent because you're a state senator. And so, and they will call me from Northwest Arkansas. They call me from around the state. So pick up the phone and call. Number two is you can please know your numbers to the House and the Senate because you can leave us messages. A quick message on, hey, vote no on this bill because this. So a quick message like that. Number three, emails. And I want to tell you this: do not get a group of people and they all send the same email. Emails with a personal touch are more likely to be read. If I get an email that says, Fred love this, and I got 30 emails in my inbox that say the same thing, I'm probably gonna read one or two of them, and I'm like, all right, I know what they're gonna say. So make your emails, they don't have to be long, but you can make your point. And actually personal stories really can also turn the tide, because you never know what will touch somebody. You never know. And they might be thinking about something in one way, and they have never thought about it the way you put it. And so that's why the personal stories are so much. I spoke to SB 58, and I was telling people are like, oh, I wish you support me on and vote against this pharmacy bill. I said, well, let me tell you all something. I said my daughter had cranial vault surgery in April of last year. In Children's Hospital we were able to be released on a Sunday, and Children's Hospital was able to fill her medication, right? And kids have a kind of a specialized medication, so they gave us some. And I can tell you this for a fact: when we tried to go fill her other part of her prescription, Walgreens couldn't fill it, and it was issued. Now, mind you, my daughter just came out of cranial vault surgery, so I need her to have her medication so that we can make sure that she's progressing down the road to recovery. And so we had to go back to Children's Hospital and get her the rest of her medication filled. And so I tell people it's a personal story to me. I mean, you know, it may not mean anything to you, but I'm just telling you that when you have major surgery and you either have pain meds or meds to stop inflammation or different things like that, I mean, that really matters to a family. And so when a personal story is always good. So and then lastly, I would say even though weekends get tough, sometimes you know we're having meetings on the weekend. Try to make as many weekend meetings. You know, try to get in contact with your legislators on the weekends. I mean, I know my phone rings all the time. Now, here's the thing that I do want to say, and I'm going to say this to our African American brothers and sisters. Number one, some of us do not live in a community where it is represented by African American, that is fine. I'm not knocking that. But please call that legislator. Please don't wear me out.
That's right.
And I'm not saying I don't want to hear from you, but what I'm saying is please don't wear me out.
Yeah.
Wear your legislator out.
That's right.
Because they need to know that hey, if they're supporting SB3, that there's some opposition from people that live in their community that don't see this bill as a good bill.
Right.
And if we begin to do that, I think you begin to see a movement in some things, the way people are voting. But I mean, it's so often I get calls, and you know, I know the people don't live in my area, and it's not that I'm gonna say, hey man, don't call me, but call your legislator. Make your legislator work, because I think that is so important. Because so many times, you know what my colleagues say? Well, I haven't heard from anybody in my area, and I know multiple people that live in their area. Why don't they call them? Now you'll call me, you'll call old Fred now.
Right.
But I want you to call, you know,
right.
Senator
Sullivan.
Yeah.
Dan Sullivan.
I want you to call, I want you to call the people that are either supporting the bill, sponsoring the bills, and tell them, because they need to know that they have people in their area that do not support what they're doing.
Right. Because when they don't hear from them, they can easily say, well, I didn't
get any opposition. That so many times. That's what I hear. Hey, Fred, I didn't hear anything from anybody in my district. And I'm like, wow, you know, and I know that there's people that reside in that district.
Yeah.
Well, y'all heard it. For all the people that's on live, you know, we gave you the rundown on ways you can stay engaged and what you need to do. Make sure you calling, emailing, attending what meetings you can do throughout the weekend on the weekends. But in particular, make sure that you voice your concerns to your state representative and your senator. It's good to keep them engaged and let them know. And I like what you said too as well about the emails. Put your own personal touch on the emails, because a lot of times, you know, we'll get in those letter writing the email campaigns, and you know, people just do the quick copy and paste, or you know, just sign the tab and it automatically do the autofill on the email.
Those emails usually go. I mean, and I've heard my colleagues say, "Oh, yeah, this," and we just delete them all. And so, and I've done that before. I'm like, all right, I know that this is going to be some support SB 71, which was the one that the last bad version we was fighting, and I just like click, delete. And so, but the thing about it is that really you really need to make a personal touch and a personal appeal sometimes, because not everybody has the same story. And so if you could tell your story, you know, you never know who that may touch.
That's right.
Make that subject line jump out to them.
Yeah.
Started off with a bang.
That's right. Well, thank you, Senator Love. I don't think we had any questions. Brady hadn't gotten any to us, so
Hold on.
is it?
Yeah, we got a
Um,
few.
okay, I may want to say something else too. I may want to say one thing in
Yeah, go
regards
ahead,
to.
go ahead, go
So
ahead.
so here's the thing. A lot of people ask kind of like, hey, why don't we have more town halls and different things like that? And I want people to understand that legislators do not have. I don't have a staff. It's just me. It's just me. And I
Right,
have a constituency services. So if you have an issue with an agency, a state agency, a lot of people call me. I was really receiving a lot of calls when it was like the assistance for different things. But call me for those issues. We'll get them straight. But as far as other issues, uh, like town halls, legislators would love to do them, but understand there needs, I mean, they can be asked to do them, and I think we should do more of them. But here's the thing is that that it takes a lot of time to actually do it because we don't have staff to do it. It's just us.
right.
And so um doing those things just take a lot. And so if you're going to request, make sure that you have a big group there, not a big group, but make sure that you have a critical mass there so that the time that's going to be well spent. Because if I plan a town hall and only 3 people show up, it's kind of like, not that those 3 people don't deserve what Fred Love was there to deliver 300 people, but
Right.
it takes a lot of time, and we don't have staff. A lot of people feel like, when you call my number, you're gonna get me, or you'll get my voicemail, and I'll try to get back to you. But we don't have staff to kind of field and put things in place for us. So I wanted to say that to understand that.
Mhm.
Definitely. We got we'll do one question
Okay.
because we answered some of the questions as we were talking and we just did check them. But we got a comment and a question, so I'll read the comment. One of our listeners says that these efforts will be just as vital for the disability community. We are out here with the voice to be heard and overwhelmingly underrepresented. And that was from just one of the listeners. And another listener has wrote this statement and a question. One of the disturbing trends in the governance in Arkansas and at the federal level is the erosion of the separation of powers, specifically the 3 branches of government. The Arkansas legislature does not seem willing to push back on bad policy and management pushed by the governor. This seems new for Arkansas. Thoughts?
I've never seen a governor I've never seen a governor come to office with this much power. I've now served with 3 different governors. Mike Beebe was a powerful governor because he had knowledge of the legislative process, and so he was a power. Asa came, and he's a pretty powerful governor. But I've never seen a legislature cede its power to a governor like this one. It to me, I was just like, oh my gosh, because I thought, even because when I came in, Democrats, and we had 72 Democrats, I do believe, and so I was talking to Democrats, and it's like kind of like they would kind of go lockstep with Mike Beebe in some things, in certain respects, but I've never seen this happen. And I knew it was bad when I was in a hearing, when I was in committee, and the majority leader said this. These are his exact words. I have to check with the second floor to ensure I could make a good change. It was a good change to a bill. And I was perplexed. I'm like, wait a minute. The governor's name is not on that bill. Your name is on that bill. I've never seen anything like it. I mean, I think it's great to be a governor if you have that much power, but I think you do you cede your power, cede the legislative power to the governor, and it's just like, what are we doing? I mean, because even though the governor was elected by the people, so were we, and we're here to actually represent our districts. And so I've never seen anything like that. Those are my thoughts. Is like I think you'll see kind of the honeymoon phase, because it's always a honeymoon phase. But I do. I mean, I when I first when Governor Huckabee first Governor Sanders, I'm sorry, first came in, there was no pushback. It was like whatever her agenda was her agenda, and we were going to roll with that. I mean, when we passed Arkansas Learns Act, we were in her office, we were in her conference room. It came hot off the press and went straight to the committee room. I was like, what in the world are we doing? And they were like, hey, this is what she wants. There should never be a time. There should never be a time when the legislature cedes its power. Just like the governor, it should never be a time when the governor cedes her power, and it should never be a time where courts cede their power to the legislature. I mean, it's just it's pretty, it's a pretty bleak day when you don't have separation of the three branches of government.
Mm-hmm.
Yeah, and yeah.
Don't look like that, man. Don't look like that outside.
No,
Yeah.
so
Hey, he
many.
ready to say some stuff. I can tell.
I know. So I'm trying to put a filter on it. So
Right.
but it's the truth. When we see omnibus bills get introduced to the public in a press conference, and then they're literally coming out of the committee passed in 48 hours,
Yeah.
and it's hundreds of pages of bills. No pushback whatsoever. And then, and now, as you can see, we're dealing with some of the consequences of that, because Arkansas Protect Act, same thing happened with that. And now you got a whole coalition of people, some legislators who actually voted for the Arkansas Protect Act, all up in arms about it, complaining about where this prison is being built. When it was pushback about it, that nobody listened to, but they just went ahead and voted for it and let it pass without much discussion. So
right.
Yeah, I mean,
these are the consequences. So.
Right. Sometimes these people forget there are consequences in how they vote.
Well, you know what, and that's the thing.
Yeah.
It's like there are consequences to your actions, and I mean, sometimes you want to think, well, I don't want to vote for this person, but you really have to really think about the policies that person is going to be pushing.
That's right.
And
especially when they tell you up front.
Thank you.
And you still vote for them.
Yeah, and you still vote for them. I mean, I think we're going to see the fallout of the educational freedom accounts.
Mm-hmm.
We're going to see because within we passed legislation to actually take down the number of kids that you had to have in a school district and everything. But people don't understand that's a fiscal number. Not a physical number, a fiscal number. You had to have 350 students in a school district to actually make it where it's financially solvent. And so when you begin to erode away students through these educational freedom accounts, and we're propping up private schools, we're not holding them to the same accountability as public schools. We're not. I mean, this is going to be a major erosion of our system, and I hope that I'm just overreacting, but I truly believe that when you begin to see rural schools close down, it's going to be too late.
Yeah.
Because we're into the third year of these educational freedom accounts, you will start seeing the fallout within the next 2 years. Because people are slowly but surely using these educational freedom accounts. And some of these are your friends now.
Mm-hmm.
Don't put that. Some of these are your friends, and I'm not gonna knock them, because you know what? When you have your child, one of the most vital pieces is getting them educated. And so, if you think you have a better educational experience over here than over here, I mean, so be it. But it'll be too late for us to reverse course when you begin to have school districts shut down, and you have to bust kids even further. I mean, you're gonna have, because not everybody's gonna be able to take advantage of these educational freedom accounts. Right. That's the first thing. You have to be in a position to take advantage of them. And for those that don't, when school districts shut down, then what is the alternative?
Mhm.
What will be the alternative? So these are things that we have to really think about. Now, I don't want to get started on that $1.5 billion, $2 billion prison
Budget.
that we might
Right.
we
Oh,
might
the
end up
prison.
we might end up building. I mean, like this is just
Right.
a catastrophe. But all right, I'm
Yeah,
done.
you
I
you
want to
sound
keep
like
my
you
I want
just
to keep my
winding
filter
up.
on too. I want to keep my filter on too. But I mean, but to be honest though, people need to hear it. I mean, we
Right.
need to have the
Right.
conversation because this prison started out at $300 million. I remember when we passed the appropriation, $300 million. Not that I voted for it, but $300 million. And then, oh, wait a minute, we got a new price tag, $470 million. And then we have issues with correction, funding correction, and finding correction officers and different things like that. And so now we might be paying $1.5 billion.
Right.
What are we doing?
It's crazy. Yeah. I'm sure we'll have a webinar on that. Osiris has been following that real closely.
Okay.
So I'm sure we'll be doing, you know, something on that. But yeah, it's a lot, Senator. It's a lot.
It is. We went through this.
It gets overwhelming just thinking about and looking at some of these bills that are coming up, and it's just it's overwhelming.
Well, don't. I mean, I would say this though, that let's not be disheartened. I mean,
Yeah,
let's fight
yeah.
where we can. And I
Right.
mean, you know, we got a little 6-shooter. All right, we got a little 6-shooter, so we got to make
Okay.
sure that we're gonna fight where we need to fight. And I mean, other ones that we can't fight against, we just let them go. But just
Right.
but for people to understand that we are here fighting.
Yeah.
And so we need to make sure that the fights and the battles that we pick and choose are the
Yeah.
ones that we really need to, because it takes a lot of energy to fight. I
Right.
mean, because
Right.
it's hard, it is disheartening to some degree to see all this bad legislation coming, and we're saying, oh my gosh, like what are we gonna do? But
Yeah.
the thing about it is we really need to push back where we can. We need to conserve our energy where we can. Some of that stuff is gonna pass and we're gonna be like, but we need to really put up the wall where we need to put up the wall. And so
Yeah.
we really need to begin to think about how we are going to fight this fight and strategically and fight it smarter.
Right. Thank you, Senator.
Yes, ma'am. Thank you all for having me.
We appreciate your time, and we appreciate everyone who has tuned in, who took the time today to send in your questions and make your comments. And for those who will watch later, we certainly appreciate you as well. And at this time, we're going to sign off thanking Senator Fred Love, who is the minority whip in the Senate, for your time and attention today.
Well, thank you all for
All
having
right.
me.
Thank you. Y'all have a great day. All right. Bye.